Welcome to MacKoul Pediatrics of Cape Coral, Florida, a pediatric office for children from birth through college age. We pride ourselves in offering high-quality medical care with short wait times, prompt phone advice from our staff, and courteous service. Our mission is to provide quality health care to children in the Southwest Florida area. After all, we want the best care for our children. But sometimes quality, coordinated care can be difficult to find. That's why MacKoul Pediatrics Cape Coral is currently working toward achieving the NCQA Patient-Centered Medical Home designation. While this designation is certainly an achievement to be proud of, we feel it's important to note that this is simply how we've always done things. Nothing is changing. We're just being recognized for all of our hard work. So, what exactly do we mean by a medical home? What does this designation actually entail? Basically, MacKoul Pediatrics provides you with a single point of contact for all of your family's health needs. We handle coordination between specialists and other healthcare providers, act as a central point of contact for patients' medical records, and help you navigate anything related to your insurance. The patient-centered medical home is a model of care that emphasizes care coordination and communication to transform primary care into more of what patients want it to be. The NCQA Patient-Centered Medical Home recognition is the most widely adopted model for transforming primary care practices into medical homes. Today's medical home is more than just a home base for a child's medical care. It's a partnership between the child, family, and care provider. It is striving to provide care that is patient-centered, team-based, coordinated, comprehensive, accessible, and focused on quality and safety. Patients in medical homes receive the right care in the right amount at the right time. This increasingly popular modernization of care delivery systems leads to safer and better care, empowers patients and their families, and renews the patient-provider relationship. Clinicians, insurers, purchasers, consumer groups, and others know the patient-centered medical home is a great alternative to the nation's current delivery system, which is costly and fragmented. Research confirms that medical homes can lead to higher quality and lower costs, and can improve patient and provider experiences of care. So how does MacKoul Pediatrics Cape Coral fit into all of this? We have comprehensive patient information about medical history, medications, test results, and other provider or hospital visits. We are responsible for the coordination of medical care to specialists, hospitals, and other healthcare providers. We provide access to evidence-based care, patient education, and support. We provide equal access regardless of source of payment. We are able to give uninsured patients information about obtaining coverage. So what can you expect from a typical visit to MacKoul Pediatrics Cape Coral? Your visit might involve a few of our friendly professionals. Members of the administrative staff schedule the patient's appointments and documents to their medical record, make reminder calls, greet the patients, and verify insurance information. A nurse or medical assistant records the patient's vital signs, records the reason for their visit, and may perform labs. The primary care provider may be a doctor, a physician's assistant, or a nurse practitioner who examines and talks with the patient and their family to develop a diagnosis and a plan of care. We will help you choose a primary care provider when you arrive at our office to help ensure continuity of care. Medical billing experts then bill the patient's insurance for the office visit. We aim to provide comprehensive, evidence-based care for your child. We are a team that is accountable for your child's healthcare needs, including prevention and wellness, as well as acute and chronic care. We provide acute concern visits, yearly physical exams, sports physical exams, and eye and hearing tests during physicals depending on age and ability, information on proper diet and exercise, referrals to specialists if needed, referrals for occupational, physical, and speech-language therapies if needed, help setting up follow-up appointments, help obtaining special formulas from WIC, discussion and evaluation of behavioral concerns and medication or referrals if needed, infant circumcision and frenotomy, reference to further literature as needed. If you are anxious about your child's health, remember that the healthcare professionals here at MacKoul Pediatrics Cape Coral are here to help you and your family obtain the best health possible. We have been voted Best of Cape Coral for multiple years now, and it's no secret that the community loves us. Let's take a moment to meet a few of the doctors and nurses who take care of your children.
Hello, my name is Dr. David MacKoul, and I founded MacKoul Pediatrics here in Cape Coral, Florida over 20 years ago. Initially, I trained as an analytical chemist at Iowa State University in Ames, Iowa. During that time, I realized I wanted to be a pediatrician, so returned to Boston and went to medical school at Tufts University School of Medicine. I also trained at the Boston Floating Hospital for Infants and Children, part of the Tufts medical system. After I completed my training in pediatrics, I practiced in central Massachusetts for about 6 years. I then moved to Florida over 20 years ago and started MacKoul Pediatrics. And the rest, as they say, is history. I hope you'll visit.
Hi, I'm Dr. Alicia Zizek, a board-certified pediatrician from Northern New York State. I attended Hartwood College where I studied biology and anthropology and ran competitively. I then went on to the American University of the Caribbean in beautiful St. Martin to begin my medical studies. I returned north to spend some time with family while practicing medicine, but after a couple of cold winters, I decided it was too much, grabbed my 2 dogs and moved to sunny Southwest Florida. I enjoy running, biking, hiking, swimming, water skiing, hockey, soccer, horseback riding, fishing, and pretty much anything outdoors. I also love traveling and a few extreme activities. I'm incredibly happy with my move here and enjoy working at MacKoul Pediatrics. My special interests include obesity and sports injuries. I look forward to welcoming new patients to this practice and know they'll love it as much as I do.
Hi, I'm Dr. Amber Loyson. I'm originally from Michigan. I grew up just right outside of Detroit. We do have a good number of patients here from up north, as well as obviously down south, and I do have some southern roots. I grew up north of Detroit, and I went to Michigan State University, where I graduated with 2 bachelor's degrees, one in human biology, one in Spanish. I also went to Michigan State University for medical school, where I received my medical degree. And then after that, I moved down south to Gainesville, where I completed my pediatric residency at the University of Florida. Shortly after that, just about 2 years ago, my husband and I moved down to this area, and where I've been practicing with Dr. MacKoul since. I'm really interested in doing advocacy for children, which means working to make sure that all children have the privileges that they need to, especially underserved children. I've received a couple of awards for work I've done in those activities. I really look forward to caring for your children and meeting your family. And in my free time, I like to spend time with family and friends, and I love to garden and bake for everyone.
As you can see, you are in good hands here at MacKoul Pediatrics. Our compassionate, caring staff is highly educated and well-trained to ensure that your child stays as healthy and happy as possible. If you have any questions or comments, or would like to schedule an appointment, you can reach us on the web at www.MacKoulPediatrics.com or by phone at 239-573-2001.